causes a polybeak deformity? A polybeak deformity is a fullness that is just above the tip in what we call the supratip. This can have two different causes. One is a soft tissue polybeak deformity, in which if you have rhinoplasty and too much of the structure underneath or the cartilage is taken out and your skin is on the thicker side, you can have scar tissue that forms in that space. The other is a cartilaginous polybeak deformity, and this is when, if you have a bump during rhinoplasty, they take down the bony part but do not take down the cartilaginous part well enough, and at the time you have swelling, and so you may see that your nose looks straight for a while, then over time the swelling at the top of the nose will go down and that just above where the tip is stays. Can a polybeak deformity be fixed? Yes, a polybeak deformity can be fixed, and the way that we fix this depends on what is causing it. If this is from soft tissue, this can be addressed by things like Kenalogor injections, 5-FU injections. This can reduce scar tissue, and if this is early in your healing process, can reduce this or make this better. If you are a year or more out from having your surgery, we will look at surgical options to fix this. If this is a cartilaginous polybeak deformity, this is something that needs to be fixed with surgery. And so a lot of times this is because some of the cartilage hasn't been taken down the way that it needed to be. And also most of the time you don't have enough support in your tip, so this droops, causing the area just above it to look more like a bump. How common is a polybeak deformity? It's not that common. It shouldn't be that common. This is something that shouldn't happen after rhinoplasty, but it is something I still see patients for in my patients that come in for a revision. So they have had a surgery somewhere else and we come in to fix the problems that they have. Is not super common, like I said, but it does happen. When does a polybeak deformity appear? This depends on the cause of your polybeak deformity. Usually you have swelling in your nose for at least the first month, so you probably are not going to see it until at least 1 to 3 months when some of that swelling goes down. So you'll start to see more of the shape of the nose. You'll see the swelling over the top of the nose go down around a month. If you have not had enough of the cartilaginous portion of your nose taken down, you will start to see that change in the shape of your nose. Have questions? Schedule a virtual consultation today at drangela.sturm.com. I would love to speak with you. Thanks for watching.